welcome the next presentation. Entitled, The Arachidonic Acid Pathway and SARS-CoV-2 Infections, a Literature Reviews on the Use of Ibuprofen and Severe COVID-19 Outcomes, presented by Mrs. Siripa Satianvatidkul.
Good morning, good afternoon, ladies and gentlemen. My name is Siripa. I'm a fourth-year medical student. So today I am here to present my studies on the arachidonic acid pathway and SARS-CoV-2 infection, a literature review on the use of ibuprofen and severe COVID-19 outcomes. So I'll start with the introductions. So you all know that ibuprofen is a common NSAID that is used to relieve mild symptoms of COVID-19, such as fever and headache. And ibuprofen works by inhibiting cyclooxygenase enzymes 1 and 2 in the arachidonic acid pathway, which are responsible for producing prostaglandins, including prostaglandin E2, which is a pro-inflammatory lipid mediator that play important roles in causing cytokine storm in COVID-19 patients. And in theory, if we think about it, NSAID should work by inhibiting inflammation and reducing severe symptoms of COVID-19, such as acute lung injury. However, in the beginning of the COVID-19 pandemic, there was a rumor saying that ibuprofen can increase the risk of severe COVID-19 outcome and can increase COVID-19 susceptibilities. Since studies on COVID-19 were very limited, there was not a lot of direct evidence on COVID-19, but there were a lot of studies on respiratory tract infections that were used to support the claim that ibuprofen might be harmful. So the aim of my review is to explore indirect evidence related to the mechanism of COX inhibition, as well as to look at newer observational studies on ibuprofen use and COVID-19 severe outcomes in hospitals. So the main search engines that I use for this extended literature reviews are PubMed and Google Scholars. Moving on to the result part, so here are some of the potential mechanisms of COX inhibition in the context of other acute respiratory tract infections that I found that might be harmful, that might cause harmful COVID-19 outcomes. So number one is COX inhibition. So the COX inhibition can reduce the production of lipoxin, which is a pro-resolving mediator, and this can paradoxically lead to a slower recovery from infections. And second is that evidence show that ibuprofen can cause a reduction of B lymphocytes, and this can decrease antibody production, leading to weaker immune response. And third is that the use of ibuprofen may mask the symptoms such as fevers, and this can lead to delayed diagnosis and delayed treatment, and therefore patients may develop severe symptoms. However, all these data on indirect evidence such as laboratory studies or observational studies on pneumonia or influenza patients were not suitable for generalizations to COVID-19. So moving on to the stronger evidence that I found, which were observational studies that were conducted during the year 2020 and 2021. So there are 10 available observational studies. Some of them are retrospective, some of them are prospective, and the subjects of the studies are either COVID-19 positive PCR people or hospitalized COVID-19 patients. And there are different time before cohort entry, which means that the durations of NSAID use before the study starts. And then the exposure is the NSAID users and non-users. Some studies specify the type of NSAID, which is ibuprofen, but some studies just generalize the type of NSAIDs. And the outcomes of these studies here are mortality due to COVID-19, or admission to ICU, or need for ventilations, or hospitalizations in some of the studies. So the results that I found is that 9 of the studies found that there is no significant difference in mortality or other severe COVID-19 outcomes. And interestingly, one study found that ibuprofen might have beneficial effects on relieving COVID-19 acute lung injury. So overall, these studies provide meaningful information, but should still be interpreted with caution because they do have limitations. And these studies are consistent with the current advice from WHO, which say that ibuprofen should be used the same way before the pandemic, taking into account the side effects as usual. And currently, there is one clinical trial called the LIBERATE trial, which evaluates the benefit of ibuprofen in the reductions in progressions of lung injury in hospitalized COVID-19 patients. However, the result of this study is not posted yet. Therefore, for now, we can reassure the safety of ibuprofen use in COVID-19 circumstance, but future work is still needed to investigate the role and mechanism of ibuprofen in COVID-19. Thank you.
Well done. Are there any questions from our judges on site?
You repeat the objective of your study.
So the objective was to, first, I look at the mechanisms that could potentially lead to the speculations that ibuprofen is harmful in the context of ruining the lipid mediator balance. So I found studies on like pneumonia, influenzas, and as I said before, it's something related to reducing antibody response or masking the symptoms. And the second objective is that I look at the recent data, which are observational studies on COVID-19 outcomes and the use of ibuprofens. And there are about 10 available studies at the time of my research.
So the included study are clinical study or mechanism studies?
I use both, but the main one would be these 10 studies here. You can see on the tables.
Those 10 studies are all clinical studies, right?
Yeah, it's the observational cohort study.
Thank you.
Thank you. Are there any more questions from our judges in online?
What is your primary outcome? Because the objective is the mechanism of ibuprofen. So what is your primary outcome?
So the outcome here is what I said, because there are 3 potential mechanisms that could lead to the speculations that ibuprofen might be harmful. So there's like lowering antibody response, masking the symptoms, and like slower recovery by stopping the lactoboxin from generating. However, these studies are not like definitive conclusions because there are laboratory studies or studies like which are based on other diseases such as pneumonias and influenzas.
Why do you use Google Scholar? The database. This database is not like medical standard database in medicine. Why you use that database?
I use mainly PubMed, but I think I just like mentioned.
I heard that you use the Google Scholar.
Yeah,
so you use only PubMed.
Yeah, PubMed
Okay,
and
sorry.
Medline.
Thank you. Are there any more questions? Thank you.